Welcome to Philanthropy in Focus, where we shine a light on the people and organizations making a difference in our communities. From executive leaders to frontline team members, each episode offers an inside look at the mission, challenges, and opportunities shaping the nonprofit sector today. Whether you're a donor, volunteer, or simply looking to connect with causes that matter, this series is designed to inform and inspire, reflecting Heritage's commitment to helping families align their wealth with purpose and impact. I'm your host, Carrie Miller, Director of Philanthropy and Business Development at Heritage Wealth Advisors, and today we're honored to be joined by Robert Bowling, CEO of ChildSavers. Hi, Robert.
Hey, Carrie. Thanks, and thanks for having us today. I'm looking forward to this conversation.
Good. Well, I am too, and I should call you my new friend, Robert, because you're very easy to talk to. So to start, can you share a little about ChildSavers and the role it plays in the Richmond community?
Sure. We always start with mission because that's the most important thing, and it drives all the work that we do. So if you come to ChildSavers and ask any employee, they should be able to tell you these words. ChildSavers guides our community's children through life's critical moments with trauma-informed mental health and child development services. So those words are really important. Guides relates to our history. We were Memorial Child Guidance Clinic before we transitioned and rebranded to ChildSavers. And we were one of the first guidance clinics in the country and the first in the South.
Oh, wow.
Our community's children. We believe that there is not a child who lives in this community that is not the responsibility of all the adults who live here. So that's really important. Life's critical moments happen twice for us in a child's lifetime. The first time is 0 to 5, when we're trying to get a child to be socially and emotionally adjusted, when the brain is making neural connections at a rate of 1 million per second, and we want to pour all the positive stuff we can into their brains. And the other time is when we need to intercede or have an intervention, and that's our mental health services. And we know 1 in 5 children will experience some type of mental health concern before they turn age 15. So the demand for our work is growing tremendously. And for us, we deal with children who have experienced pretty significant trauma. And that's our area of expertise. And combined with this area of early childhood education, where we really help providers deliver quality childcare for kids. And I'll talk more about that a little later.
Okay. Well, I have a 0 to 5 little guy at home. So we are very fortunate that the community is so involved in his upbringing. It's fun to watch. Every organization has moments that define its impact. What's something you and your team are especially proud of?
Well, last year we celebrated our 100th anniversary.
Wow.
Work in this community. And we started, oddly enough, right after the 1918 flu pandemic, when children in this community lost their parents. Oh. And there was no one helping. Many children were living on the streets. And a group of concerned citizens urged the public sector and the private sector to come together to support these children and their well-being. And that was our beginning. We tell this story because we think it's important. We talk about our history. When we first came together, we only served white children. But a year later, we began to serve Black children in a segregated fashion. Today, ChildSavers is very different. We are now a program that focuses in on mental health and child development. And we serve any child who comes to us regardless of the ability to pay. So that 100th anniversary, 100 years of doing business, now I'll say 101 years of doing business is important to us. In addition to that, we had 2 other monumental moments. The first was we decided in 2018 that we needed to get closer to kids to do our mental health services. And the number one place was where kids spent most of their time during the day, in school. So now we have clinical staff inside of, I believe it's 25 Richmond public schools, 5 schools in Hopewell, and 3 schools in Colonial Heights. And so that change in business was really important for us. And the last piece is our work in child development. we now do work not just in Central Virginia, but we also handle work out in Southwest Virginia. So those achievements are significant for us.
That's wonderful. For those who feel inspired, what are some meaningful ways people can get involved?
Oh, I can tell you a lot. So my development team will say this: you can always give to us. We love that. We operate from three sources of revenue. One is obviously our contracts. We get insurance reimbursement for our mental health work, and we raise money.
Great.
And those three pieces, think about them as thirds, a pie cut into three pieces, are really important. So you can give. The other way is those two issues that we talk about, childcare and mental health, are two of the most important issues for our community. And you can advocate for public policymakers, whether that's at the local, state, or federal level, to put resources into those two areas. Because if you think about early childhood education, if we prepare kids socially and emotionally, they will be ready to learn by the time they reach kindergarten.
Yeah.
And if you think about our workforce, there are many people who are trying to go to work who have young children. Many of them are women. And we try, our work is to make sure that those women and families can put kids in safe, quality places. If you think about mental health, access to mental health is very difficult in this country. And we provide mental health for kids who are severely traumatized, meaning if you think about toxic trauma and the traumatic events that happen in people's lives, toxic trauma happens when you have 4 of those experiences. For the children we serve, they average 6. And the average age of the kids we serve is 9 years old. So there's this opportunity to think about how we want to support these kids by advocating. And the last way is to volunteer. We have activities that you can do to come help us out in our what we call our common waiting room. There's a chance to come and read to kids or to play games with kids while they're waiting for therapeutic appointments. We have on our website a wish list, and that wish list is snacks that we give to kids when they come to session, or snacks that you can give childcare providers to help support them so they won't have to purchase those kinds of things. We would love for you to do that. There's supplies that you can provide for us, and you can drop those off at ChildSavers. We have one caveat. Think about the supplies and snacks that you would give to your children. And that's the kind of snacks that we want you to provide to our children. Because remember, they're our community's kids. So those are 3 different ways you can get involved in our work.
That's great. So you must have a lot of partners and collaborators and organizations that you work with to do some of this work.
Sure.
Who are some of the big ones? Sure.
So probably our biggest partner on the mental health side are school systems. So Richmond, Colonial Heights, Hopewell. We also serve kids in Henrico, Chesterfield. Any school system in Central Virginia probably touches us. There's a kid to come to us to that. So those are our big partners. There are community-based partners like communities and schools. That's a really important partner for us because they help coordinate our work inside the schools. Our number one partner, if we think about it, is childcare providers. And those partners are either those individuals who are providing care for children in their home, up to 4 kids per home, or big centers, which can hold 150 to 200 kids. And so those are the critical partners we work with. We do a lot of work with public policy makers, so local government, state government, even federal government, to help them understand the issues that children are facing. Other organizations are like Virginia Early Childhood Foundation is another public-private partnership that is looking at child care issues, and Voices for Virginia's Children, which is the number one statewide advocacy organization for children.
I know it takes a village, even when it comes to nonprofits. So for those, well, let me back up. What would you say is ChildSavers' greatest need right now, and how can supporters make the biggest difference?
Okay, I'm going to say it again. Number one is resource. So if you could do that, we would love it, and give to your ability. Number 2 is I'm going to go back to that advocacy, because policy change around getting us to think about children in those years 0 to 5, when that brain is making that neural connection I spoke about. we need to really focus our attention as a community on workforce development, because if people can go to work and feel comfortable about their children being in safe spaces, then we'll have a better workforce. Mm-hmm. And if you think about the pandemic, when we thought about essential workers, a lot of times we thought about healthcare workers, rightly so, and other people like that. But for us, it was those folks who took care of the healthcare workers, the folks who worked in hospitals, cafeterias, cleaning the hospital to make it safe for patients and the staff in those spaces. Those were the people that we supported. Mm-hmm. And as I think about what we can do as a community to change our outlook about childcare, that's one. Thinking about social and emotional well-being. And the other pieces around mental health, our investments in mental health in the state there have been some improvements in recent years, but still a long way to go. Mm-hmm. If you think about a quality hour of therapy with one of our clinicians, that costs us about $150 a year. Mm-hmm. The insurance reimbursement is around $69. Oh. So that gap we have to fill, so your audience can really help us do that.
And I know it's a challenge to your previous point of getting the child to the appointment. I mean, a parent has to, or a guardian has to come, and typically these appointments are between 8 and 5, and that's when a lot of them are working. I mean, it just becomes a real challenge.
It really is challenging, and that's why we actually have hours. We will see kids from 8:30 in the morning to 7:30.
That's wonderful,
to provide that opportunity for families to come after work.
That's really great.
Mm-hmm. So it's really for us. I think the commitment from our community to its children is the most important commitment we can make. And I'm glad ChildSavers is embedded in these two spaces that are critical for children to survive, prosper, thrive, be safe, happy, healthy, and ready to learn.
Well, you, it's just, you're so warm and engaging when you talk about it. Like I'm really impressed, and ChildSavers is fortunate to have you, but you seem to embody it too. So
thank you, Carrie. I really appreciate it. And I just want to say this. Yeah. I have the fortune to come out and do things like this and to talk to people about what we do, but it's my teammates who really do what we call boots on the ground work. And if you think about our child development team, they're with child care providers every day, teaching, helping them understand what a classroom should look like, what curricula should look like, what food to feed children, because many children will eat their only meals during the day in the child care setting. Or our mental health professionals who are hearing these stories of trauma and really guiding the child and their family through a process to build back resilience so that child can prosper for the rest of their lives. I'm honored to do this work. I think our teammates would say the same thing, and we're glad we're part of this community and hope to be here for another 100 years.
Well, our community is fortunate to have you and your team. So thank you for all that you do for Richmond's children.
Absolutely.
Well, I think that's everything I had for you today, Robert. And I just want to thank you so much for sharing all of this about ChildSavers and the work you're doing.
You feel free to call us at 804-644-9590 or go to our website, childsavers.org. And you can see ways that you can help us and learn more about the work that we do.
And we will have a link to Give and to the website on in our show notes. So thank you for being here. And for those who want to learn more, get involved, like I mentioned, the links will be in the show notes. And I'm Carrie Miller, and this has been Philanthropy in Focus. See you next time.